All right, let's dive into this. For a long time, we thought concussion recovery was just about sitting in a dark room and waiting. But, the whole game has changed. Today, we're going to break down the modern, active way to recover, and we're using the latest clinical practice guidelines from the American Physical Therapy Association as our guide. This is all about getting smart, targeted care. So, right off the bat, let's just bust a huge myth. A concussion is not just an isolated brain injury. Think about it. The forces that cause it can ripple out and affect multiple body systems. And that's exactly why a one-size-fits-all recovery plan just doesn't cut it. The new approach is to see it as a multi-system problem. And that shift in thinking is absolutely crucial. So how do clinicians get a handle on all this? Well, you can think of it like a 4-point inspection for your body after you've been injured. The guidelines break the examination down into 4 key areas to systematically figure out what's really causing your symptoms. Now, this isn't just some quick checkup. The official term is a comprehensive multi-system physical therapy examination. The whole idea here is to go way beyond just listing off symptoms. It's about digging deep to find the specific problems in your body's systems that need fixing. It's all about precision. Okay, let's get into our first inspection point. And this one might actually surprise you. It's the neck. The guidelines put a huge emphasis on checking out your cervical musculoskeletal function. And why is that? Well, because the same forces that rattle your brain often cause a neck injury, kind of like whiplash, at the very same time. What's so wild here is the direct connection they found. A problem in your neck can be the main reason you're having symptoms we normally just blame on the brain. Things like headaches, dizziness, or even trouble with your balance. The neck is so often the hidden culprit. So what does this exam actually look like? Well, your physical therapist is going to be really systematic. They'll check your neck's range of motion, its strength, they'll assess how the joints are moving, and check for any tenderness. And they'll also test something called joint position error, which is basically your brain's internal GPS for where your head is in space. It's a really thorough look at the whole structure. All right, on to inspection point number 2, the vestibulo-oculomotor system. I know, it's a mouthful, but all it really means is the super important communication link between your inner ear's balance system, your eyes, and your brain. A concussion can really throw this finely tuned network out of whack. Now, what's key here is that this part of the exam is triggered by very specific things you might be feeling. The guidelines say to do this deep dive if you're reporting dizziness, nausea, or that classic overwhelmed feeling you get in a busy place, like a grocery store aisle. And this gives you a great idea of how they test it. Your PT will check smooth pursuits. That's your ability to smoothly track a moving object. Then they'll check saccades, which is how fast and accurately your eyes can jump between 2 different targets. These simple-looking tests tell them a ton about how well your brain is controlling your eyes. But it doesn't stop there. The full exam can look at how well you can keep your gaze steady while your head is moving, or how well your eyes work together as a team to focus on something up close. That's called vergence. They might even do positional testing, like the Dix-Hallpike test, to see if the little crystals in your inner ear got knocked loose, which can cause a really specific kind of vertigo called BPPV. Okay, let's move to inspection point number 3, which is all about how your body handles physical stress. We're talking about your autonomic nervous system. That's the part that runs on autopilot, controlling your heart rate and blood pressure, and your tolerance for exercise after the injury. The reason this is so important is that for a lot of people, the symptoms don't really pop up when they're just sitting still. They get triggered as soon as their heart rate starts to climb. So an exertional test is designed to find out exactly where that line is in a totally safe and controlled way, so a recovery plan can be built around it. The process itself is super methodical. It always starts with getting a baseline reading. Then you'll start some light aerobic activity, usually on something like a stationary bike, so you don't have to worry about balance. The intensity gets bumped up slowly, while you and your PT are monitoring everything. The second your symptoms start to kick in or get worse, the test stops. That point is a critical piece of the puzzle for your recovery. And that brings us to our 4th and final inspection point, motor function. This is where we look at those higher-level skills that need your brain and body to work together perfectly, like balance, coordination, and even multitasking. This is where things get really insightful. You might feel totally fine just standing or walking around, but the guidelines point out that these little deficits often only show up when you're challenged, specifically when your brain is trying to do 2 things at once. This is where something called dual task testing is so revealing. So the assessment will look at your balance when you're still and when you're moving, for sure. But the real key is often that dual tasking part. Can you walk in a straight line while you're counting backwards from 100 by sevens? Can you keep your balance while you're catching a ball? These are the kinds of tests that expose those subtle little coordination problems that can hang around after a concussion. So after going through this whole comprehensive 4-point inspection, you're not just left with some vague diagnosis. No, you're left with a clear, targeted roadmap for how to get better. So let's just pull it all together really quick. We've looked at the 4 key areas: the neck, those complex eye and balance systems, your body's tolerance for exertion, and finally, your higher level motor skills. By checking out each of these, a clinician gets a complete 360-degree picture of how the concussion has really affected you. And this is the ultimate takeaway. This isn't just about figuring out what's wrong. A physical therapist uses the clues from this detailed exam to build a treatment plan that is 100% tailored to you. If your headaches are coming from your neck, they treat your neck. If your dizziness is from your vestibular system, well, that's what gets addressed. It's truly personalized medicine in action. So I'll just leave you with this thought. The future of concussion care isn't about passively just waiting for symptoms to fade away. It's about actively understanding that a concussion is a multi-system injury, and then using a detailed inspection like this to find and to precisely fix what's actually broken.